only 12:30, and it's time to introduce the man in the big white coat. And the man in the big white coat is across the table from me. One, James Geraghty. I have to ask myself, where in the name of God is time going?
Jerry.
Blink an eye and you're gone. Blink another eye and you're back, James. But it's good to have you back.
Lovely to see you, Jerry.
Here we are. Jimmy, we're going to start today with the letter that came from one of our listeners.
Yes, and I think it's quite an apt letter, Jerry, and I think we'll just read it out here.
Please.
And maybe go through it. So it says, Dear Jerry and James, I would like to ask James's advice on my health issue. I was diagnosed in May as a pre-diabetic. My fasting glucose is 5.7 and my HbA1c is 46. I am having another blood test in October. Any advice would be much appreciated. I'm not overweight and exercise regularly. I am 75 years old. Kind regards, Mary.
So what say you to Mary?
Well, I am saying to Mary, there's hope. That's the first thing.
Yeah.
The second thing is her fasting glucose is 5.7. Usually we like to see that below 5.6, so she's not far off there.
No.
Her HbA1c.
What's that, James?
It's basically where the glucose, it's glycosylated hemoglobin, and basically it's an identifier of how much glucose is in the blood, Jerry.
Okay.
So it's 46, usually with, coming under 42 there. So there's a couple of things that herself can do. Now, it is October, so she's going to be getting the test in October, but the most important thing here is how do you lower that glucose level? How do you make the body more sensitive to insulin so it promotes the absorption of insulin or glucose back into the blood cells? So there's a couple of things here. She's saying she's exercising, which is fantastic. The one thing I would suggest to her is increase the level of protein or fibre in her diet. That's soluble and insoluble fibre. If she pops into one of her stores or into any store and gets some multi-fibre plus,
right,
and takes about maybe 2 tablespoons of that every day, say 30 grams of that every day, mix it through her porridge, and she will find a difference, because what that does is it slows down glucose absorption, and then that triggers the body's response. It sensitizes the body's response to insulin.
Daft question maybe, but if she didn't like porridge, can she take it in any of the cereal?
She can,
okay,
Jerry, yeah. But we have to be careful here, Jerry. You see, the problem here is the level of simple carbohydrates going into the system, and you have to be careful there. So complex carbohydrates, say something like Weetabix, something like porridge, for example, muesli, ready break, something like that. So if she added something like that into her breakfast in the morning, that would have a significant impact in relation to the absorption of the glucose into the system. But again, the hidden sugars is the problem, the simple sugars. So make sure she keeps them low in her system. For example, the biscuit, the cake, all of that over the next 3 or 4 weeks.
The sugar and the tea.
The sugar and the tea. I was very good today, though, Jerry. I didn't have the custard cream.
I did that. I took care of that for you. So, James, would anybody know if a person in Ireland would have a charm for severe migraine? My daughter's not responding to any treatment.
I can't say I've ever heard of a charm for severe migraine. And as a person who suffers from migraine intermittently, Jerry, the key, and I can give from my own experience, the sumatriptan medications are very good. Now, I find that the tablet works for me, but there is a spray and an injection, and I would definitely recommend for that person to talk to a GP or a consultant neurologist in relation to that. And again, going back to the key here about hydration and sleep are very, very important, and decrease in stress in that person's life. If they do find, obviously there's the whole issue of light and keeping out of light in relation to an attack. It's very, very important that they actually isolate what is the cause of this. Say, for example, myself, if I take, say, for example, chocolate and wine together, I can be assured that I'm going to get some. So it's that individual trigger. So what I would suggest to that person is, number one, watch the triggers, and number two, have a chat with the GP or the pharmacist in relation to the different types of triptans that are out there for this actual issue.
So there is help as well.
Absolutely, and the Migraine Society of Ireland are absolutely fantastic.
Okay, James, can you give advice to someone who would like to go on a protein diet?
Well, a protein diet. So by going on a protein diet, usually what you're doing is decreasing the level of carbohydrates in your system. So by decreasing the level of carbohydrates in your system, you're increasing the body's capacity to burn fat, okay? But again, it's all about knowledge and using what's important. Say, for example, increasing the levels of fish, tuna, salmon in your diet.
This is a protein diet.
This would be increasing protein. You can also use, say, for example, the likes of protein powders, But by doing that, you're actually increasing the levels of protein in your diet. And the key here is to decrease, again, what we talked about, simple carbohydrates in your diet. So by just decreasing, say, your cakes, your biscuits, that type of stuff in your diet, your protein intake will actually increase.
Okay, all right, very good. What causes Raynaud's disease, and is there anything that can be done to stop or alleviate it? You might give us a sentence, first of all, on what Raynaud's disease is.
Raynaud's basically, Jerry, and you sometimes see it, it's where the external and the extremities, especially around the fingers and the feet, where they can get extremely cold.
Okay.
And the arteries in the micro arteries contract, so you don't get blood supply. So especially in cold weather, they can become really cold, they get very, very blue. They often recommend, there are some herbal circulatory products out there that sometimes can help. I've often seen actually turmeric is actually quite good. But again, you just have to be careful. Sometimes there's triggers and there's medicines there that can potentiate that. So having a conversation with the pharmacist or the GP is also important.
James, what's the best cure for a yeast infection in a male? Would you recommend Canesten cream? I presume that's Canesten cream.
Yes.
And cheers. Yeast infection, James.
Well, it could be anything, Ger. It could be, it could be a yeast infection in the foot. It could be a fungal infection in the foot, or it could be in the private parts. Canesten cream will actually work in both parts, or I was going to suggest there Dactarin. If the person is getting an itch, they can also add in a little bit of hydrocortisone cream there for a couple of days just to ease down on the itch. Now, if they are still struggling, they will have to see the GP. There is a particular product called Dactacort, Jerry, which basically is a combination of a steroid and an antifungal, which is quite effective. But they'd have to have a conversation with the GP. If it is around the penile area and it's not going away, they have to be careful there around sexual contact, and it may be a conversation there to have with their partner,
right,
and also to have a conversation with their GP.
Thank you very much. James, is it safe to take turmeric joint care tabs with cholesterol and thyroid tablets? Thanks in advance.
100%. What I would say there, if they're taking the turmeric, take it in the morning with some food. Okay.
Take it in the morning.
Yeah, just so that doesn't upset the cholesterol. By its very nature, the statins are very, very good, and the thyroid tablets, again, thyroid tablets need to be taken on their own, and they need to be taken without food or coffee or anything like that. So just be aware there. If a person is on long-term thyroid medication, it's important that they actually have a conversation with the pharmacist around when to take them. Usually I recommend, say for example, I'd often say to people who are on long term, maybe get up an hour early and just take your thyroid tablets straight away, and then have your breakfast an hour later. Okay.
James, I'm on warfarin for years. Lately I'm feeling very run down and tired. Can you recommend some vitamin supplements? Thanks. Warfarin is a blood thinner, is that right,
Absolutely, Ger. And it was one of the first blood thinners, and it comes in different forms, a 1, 3 and a 5. It's a blue, a brown and a red. So, what happens there is that your blood is often tested into INR, so your international normalized ratio. So the nurse or the GP will look at that and see how it's actually flowing.
Right.
Yeah. So they will actually move the different tablets to get the best flow and to make sure it's not clotting. So in relation to that, usually you can get a pretty standard vitamin. But the key here is to have a conversation with the nurse or the doctor to say, look, I'm taking, a multivitamin for the next month or so. And they will be able to say, because you can sometimes get what's called an atypical reaction. So it might never happen for 100 people and might happen for one. So it's an atypical reaction. So it's important to talk to the GP or the nurse about that.
And should one talk to the pharmacist
Absolutely.
when they're going in about and say, look, I'm on warfarin.
Yes.
Can you recommend that?
Absolutely, Jerry. And I often get people coming in who are on blood thinners, and we have a good chat about it. But the key is communication.
Yes.
To be able to come in and, sometimes I find that people will come in and they'll just mention at the end, by the way, I'm on blood thinners.
Yes.
You need to mention that at the start, because my colleagues can either mention it to myself or one of my pharmacist colleagues, or in effect have a conversation with the nurse who's doing the test, or for example the GP,
Yeah.
because it's important that they're aware, because they might come back and there might be no issue with the blood result, and they might be looking at it saying that's changed from last month. Why is that? And they may have been put on a vitamin, and there could be an atypical interaction between one of the vitamins and the warfarin. So we need to be aware of that.
James, I need to get up several times a night for toilet, and I suffer a lot with burning sensation when I do go to the toilet. Any solutions? Thank you, says Marie.
Well, it's a lady, Ger. I'm thinking there could be an issue there with a slight infection, or it could
UTI.
be UTI, Ger. But I'm just guessing here. The fact that she's getting up several times at night, she's getting a burning sensation would be suggestive of that. But again, it would be down to a GP to make a diagnosis on that. What I would be suggesting in the meantime, if she popped into her local pharmacy and got something called cystopurin, and she used that for a couple of days, and she used something called D-Manos, either as a powder or a capsule, and used that over the period of the next week or two, if she cannot get to her GP, because there may be an issue there with where she has urinary frequency, where she's going to the doctor, where there may be an issue with what's called the detrusal muscle around the bladder, which might be a little bit irritated. So that may need a suggested conversation with the GP.
Thank you. Good morning, James. Recently I had a high cholesterol reading, well over 7. I went on red yeast tablets, also took a cholesterol drink every day, and in 3 months my cholesterol was down to 6. My question is, do I keep on taking both of these products? And what about resveratrol? Can I take that as well? Many thanks. So we'll deal with cholesterol first of all now.
Okay, well, the first thing we have to say to Mary is well done.
Yeah, from 7 to 6.
She's down from 7 to 6. She's on her way. So she's on the downward trend there, Jerry, and she's doing really well. You know, if you look at her cholesterol, it's down to 6. So she's a point, maybe a 1.2 outside the norm.
Yeah.
Good if I said 4.85. My question is, do I keep taking both? Absolutely. Why not? It's doing really well there. It's suiting her, Jar, and 3 months is a good time. So in 12 weeks, she's come down a point.
So keep at it.
So yeah, keep at it. And can she add resveratrol? Absolutely.
What
There's
is
no reason.
what is that?
Resveratrol is an extract from grape, and it's been shown to be very effective in reducing down cholesterol, total cholesterol level.
Very good.
So adding that in, now I'm sure, so that'll be 3 months. So I'd say she'll be going back to the GP in maybe another 3 months, Jar, to have the conversation, to have another blood test. And I wouldn't be surprised if she drops another point. Now, she can add in the resveratrol, pops in there, coming in about 4.9, 4.8. The GP will be very happy.
We'll do one more before the break. James, what vitamin would you recommend for someone in their 60s to take for the winter season?
Well, Jerry, I've just started on my Energy Plus 1 in the morning. I find it very good. It's just 1 a day capsule. For people who don't like taking capsules, I take the tonic, just 2 little spoons in the morning. I always like to see where a vitamin is taken just in the morning, Jerry, either as a liquid tonic, rather than taking it throughout the day where you have to take a spoon 3 times a day or whatever. So just take a couple of spoons of the, say for example, the Benefits multivitamin, the Pharmaton vitamin, or the Benefits Energy Plus capsule, Pharmaton capsules. Very safe, very, very effective.
Perfect. All right. Well, now then that's where we'll hold and give you a chance to get your break. 087 941 41, by the way. And just to remind you too, even though we'll finish here at about 3 minutes to 1, then we'll go onto our Facebook page.
Correct,
and we'll
sir.
go live to answer all the questions that need to be answered that haven't been answered on the radio. May's time is 12:44.
With Delaney's Mace, we can't be beat.
So James Geraghty, our pharmacist, is with me in studio. And James, I want to talk about a couple of products that we get lots of queries about. We get lots of queries about osteoporosis,
Yeah.
and we get lots of queries about skin, hair, and nails, and we get lots of queries about a general vitamin, really, for general health, well-being, and balance.
Yes.
And you have come with some good news today.
We have, Jerry. Now, I have to, first of all, say thank you to my wonderful colleagues, the likes of Greg, Martina, and Rita, who've helped me along this journey of developing these particular products for our customers and our patients. The first one, Osteoflex. It's a very, very good combination, Jerry, of natural anti-inflammatories and very good for osteoporotic pain and promoting and helping supporting joints. So the key is, and I often say it to people, taking a good supplement along with a good diet, hydration, and watch the weight, and you'll get benefits out of it. Now, we've done that with the Osteoflex. As you know, we get loads of conversations here about the old skin, the hair,
Sure,
and the
every
nails
month,
every day. And on the back of that, because so many people have come into me in the store and said, James, when are you going to do it? Well, we've done it. And we've brought out the Benefits Skin, Hair, and Nail Blend. And that's a combination of, it's collagen, vitamin C, it's got biotin in it, hyaluronic acid, grapeseed extract, a ginger, 1 to 2 a day for 4 to 6 months, and you'll see a real improvement. And one of the things when we asked our customers, especially among younger women, was issues around period pain and just general discomfort with periods and stuff like that, and menstrual cycles. So we brought out the particular one called Monthly Balance, which is a combination of herbs and supplements that'll basically help ease that journey with the monthly cycle. So pop into any of our stores, go onto our website. We've done a couple of TikToks on them as well. And if anybody wants to give me a shout on any of them at all, or if I can help in any way, give us a call on 096 60072.
You'll advise.
I'll do my best.
You'll advise. Okay, James, what's the best way to treat a sensitive tooth? I got a tooth pulled ages ago, and now the one left behind is very sensitive. I use Sensodyne and salt and water as recommended by a dentist.
Well, it's funny, Jar, because I know I was talking to one of my wonderful colleagues this morning, and she was complaining about a sensitive tooth last week, and it turns out that it was actually a wisdom tooth, and I'm just delighted that she's got it sorted. But in thinking about that, Jar, for this particular lady, I'd love her to get a little bit of Benefits gel and a little bit of clove oil. So just massage, get a cotton bud and put a little bit of clove oil on it, and then put a bit of Benefits gel on it in any of her stores or online, and just put a little bit of that into that affected area. And I really feel that that'll help her. And she can use that every 2 or 3 hours. But if it's ongoing sensitivity, she's going to have to talk to the dentist.
Back to the dentist, okay. James, a caller wondering what would be the signs of tongue cancer?
Well, first of all, if they have a worry about something that's unusual on the tongue, I'd usually recommend straight into your pharmacist or your GP and have the conversation. Usually I would see people maybe once or twice a week that'll come in and they'll have a white covering on their tongue, Jerry, or they'll have an area of the tongue which looks kind of inflamed or sore. And these can usually be treated at the pharmacy, because usually it's a thrush infection, and we can give something called Dactarinor gel, which is extremely effective. If that person has worries about that, they need to go today to see their pharmacist or GP.
Do not delay.
Absolutely.
Do not delay.
Absolutely.
James, I'm taking liver blend tablets with the cholesterol tablets, and it's still at 7.2. What should I do? Should I continue on the liver blend?
There's no reason why they wouldn't continue on the liver blend, Jar, but they have to add in resveratrol. Liver blend is more, it increases the capability of the liver and its functionability. But to move the cholesterol along, we need to add something extra, say like Red Yeast Right or resveratrol, just like that lady in the previous question, Jar, and she's doing really well.
Down to 7 to 6.
So, yeah, so if the person there adds in resveratrol, and what I would suggest for a little kickstart over the next 2 months is that if we add in a little bit of Multifiber Plus there, just a couple of spoons into the breakfast in the morning, then we'll see big results.
Okay. James, what can I do for, ironically, a smell in a person's nose? The smell is, the smelling organ is smelling a smell.
Yes, and I'm thinking there, Jar, either they have an infection in their sinus, they have a blockage, or else they have an issue with long COVID. I would be definitely talking to my GP.
Would you?
GP there. Now, what I have done in the past where I have seen this is usually I'll get a saline spray, where you can spray it into the affected area maybe every 2 hours, maybe for 3 or 4 days, and that seems to ease that down. But if you have an ongoing sinus infection, Ger, where you have a lot of bacterial infection, that can give a smell in the nasal area, and the only way to deal with that is GP and antibiotics.
Jerry, can you please ask James if it's all right to take wheatgrass powder along with 10 milligrams of statin?
Absolutely, Jerry. Wheatgrass powder is what I would consider a superfood. It's wonderfully effective. Its concentration of nutrients, supplements, and overall well-being is very, very powerful. So using that along with a statin, it's actually a really good combination.
No problems
Yeah,
there.
absolutely.
I have a prolapse and have a ring fitted. I get kidney infections very often, and I'm wondering if I could take something to help reduce or eliminate them.
That's tricky, Ger.
Okay.
Yeah, because prolapse ring fitted, we have to be careful.
Is that a prolapse of the bladder, Jim?
Either a prolapse on the bladder, or sometimes you often get a prolapse in the womb area.
Okay.
Yeah, so we just have to be careful here, Ger. I get kidney infections very often. Okay, so we have to flag, are you talking to your GP about this? That's really, really important. If they're not talking to the GP, that's the first thing they need to do today. The second thing they need to do is pop into the pharmacy, get some cystopurin. There's another particular product that's been released lately, Ger, for that you can get over the counter for kidney infections. It's slipped my mind at the moment. But another thing they could use also is D-Mano. So they could use those two products along with a conversation with the GP or the pharmacist to see how they're doing. And use that for maybe about a week or two. But make sure you pop in and have a chat with your pharmacist and just, explain to them, these are the symptoms I'm getting, this is the issue that I have. And if that is not working, they need to be talking to their GP.
Very good advice. James fell asleep awkwardly on my arm. 2 fingers, the little one and the ring finger, are numb with tingling. Pins and needles, and the palm is also numb.
Interesting, Ger.
Yeah, because it
I
should
wonder
go
when they fell
away.
asleep.
Yeah.
What do you think last night?
But you'd imagine even if they did fall asleep last night, in fairness, that shortly after they get up and
it
about,
would be coming back. It
should
should be coming back. So what I would do there, Ger, and sometimes you can sleep, and when you sometimes knock your funny bone,
of course,
and
yeah.
it can all go asleep. So what I would do there is, if they have a little bit, now not a spoon or anything, but just a dab of olive oil around the actual area of the funny bone, around that tendon area, and just massage that particular area first of all, and then around the areas where they're feeling this numbness, just massage that area with a little bit of olive oil, just to stimulate, number one, the nerve, but also the blood vessels.
And James, if it's a thing that numbness isn't gone, say in the next number of hours or by tomorrow, what should they do?
Absolutely, Ger. They need to be popping in, making a call with the GP,
Okay.
And also, Ger, you brought up a very good point there, just in relation to, are they getting pains down, one of their arms, are they feeling short of breath or whatever. Anything like that, they need to be proactive. Yeah.
And we'll do this one now. Would you have any advice on a herbal remedy for acid reflux? I'm on Nexium on the generic version for over 20 years, and I'm told not good to be on those for that length of time.
Okay, well, there's no reason why they can't be on the Nexium, Ger. Obviously, the GP has prescribed them. There's an issue there with acid reflux. But there is a particular product called Mastica gum. We've often spoken about here,
yes.
Ger. And what they could do is to use that, or even if they use Gaviscon or Gaviscon Advanced, Ger, along with the Nexium, that will actually help the Nexium work a lot better, because the Nexium is blocking the release of acid into the stomach. And the problem is sometimes it's not been allowed to heal. So using a little bit of Gaviscon or Mastica will cover the area and allow the actual the stomach to heal. So if you have an irritation or whatever, just like say you get a scrape on your leg or anything, it needs time to heal, Ger, and that is the key.
Perfect. All right, that's where we hold this section.
Can I just say, there's an Instagram competition going. Emma will kill me if I don't mention it. It's a big prize, and if you just go in, link, and whatever they do on Instagram, just do it, because I don't want to get in trouble with the wonderful Emma.
Malloy's Pharmacy on Instagram. And
absolutely. Thank you, Jerry.
And speaking of Malloy's Pharmacy, James, of course, 096 60072
yes,
for you and the team. Your website is
www.malloyspharmacy.com.
Perfecto. And of course, for those questions we haven't answered, stand by, friends, because we're going to go to Facebook Live in about 4 minutes' time. In the meantime, thanks to you all. Back again tomorrow with God's help.